Welcome back to Dive Current. My name is Steve Lucian. This is part two, talking about cardiovascular health and diving. If you haven't seen part one, I'm leaving the link in the description below. I'm going to ask that you watch that first. So click on there. Now, if you already watched it, let's move on. I have Dr. Doug Ebersole. I'm going to have come on the channel here in just a minute. I'm going to be interviewing him. You're not going to want to miss it. All right, let's get started. I am with Dr. Doug Ebersole. He is an interventional cardiologist. Is that correct, sir?
That's it.
All right. Sir, if you could please just introduce yourself for us. I know a lot of people already know who you are that watch this channel, but there may be some that do not.
Okay, thanks. Yeah, as you mentioned, I'm an interventional cardiologist. What that means is my job involves procedures. So I go to work the equivalent of in my pajamas and play video games all day and then come home. So I'm in scrubs all day and I'm either in the cath lab or the operating room during procedures. So that's what pays for my diving. From a diving standpoint, I started diving in 1974, so well before you were born, and started technical diving and rebreather diving in the early 2000s. Started teaching rebreathers in 2005. I'm currently certified on 11, and I teach 8 of those 11,
Wow.
um, all the way through CCR Trimix, CCR Cave, and so forth. So, because of my diving background and my medical background, um, Divers Alert Network came to me a decade or more ago, and I'm the cardiology consultant for Divers Alert Network. So I get lots of cardiology issues in diving. So this sort of interview is something I do on a regular basis.
Well, thank you so much for that. Yeah, to say that you're an expert in your field is an understatement, and that's why I couldn't think of anybody else that I wanted to ask to come on. So I do appreciate you joining us today. So I sent you a video the other day of that gentleman, Brian, who had a heart attack. My first question to you is, what is the necessary level of fitness to become a diver?
Okay, so as you know, when people take their open water class, they have to be able to swim 200 yards, uh, unlimited time. So you have to have some level of fitness. If you're thinking about that, think about getting into diving, and you're not much of a swimmer, so you're saying, well, how physically fit do I really need to be? In general, if you can walk about 2 miles in under 30 minutes, that'd be the equivalent of what we call 6 METs. And METs is a metabolic unit. Right now, you and I talking, we're using about 1 MET of activity. So 6 METs would be 6 times that. That's walking about 2 miles in a little under 30 minutes. That's all you'd really need to do to be physically fit for recreational diving. Now, if you move into something like technical diving, so you're in more extreme conditions, or you're an instructor, so you're now responsible for other people, you obviously should be more physically fit. And the recommendation there would be something more like what we call 13 METs, which would be the equivalent of walking kind of 11-minute miles.
Okay.
Um, if people have access to a treadmill, these numbers come from what's called a Bruce protocol treadmill that we do in cardiology all the time. And 6 METs on a Bruce protocol for recreational diving would be going at about 2.5 miles per hour at a 12% grade on a treadmill. So if you
Okay.
can kind of maintain that, that gives you kind of a handle on that. And then the next level, which would be kind of in the 9 to 10 MET range, would be the next phase, which would be 3.4 miles per hour and 14% grade. And then if you can hit 4 miles per hour with a 16% grade, that would get you in that 13 or more METs. So that's kind of what
Wow.
you're looking at. Okay,
Okay.
so that's kind of some round numbers if people have access to a treadmill. But really, if you can jog, you're probably more in closer to that 13 METs. And if you can walk 2 miles in half an hour, you're closer to that 6 METs. So that gives people kind of a general idea of the physical fitness they would need to dive.
Awesome. Thank you for that. So, along the lines of being a healthier diver, that's what this whole series is about. I wanted to ask you, and we've talked about it a little bit previous, but I wanted our viewers to know, which was kind of shocking to me. What is the leading cause of death in divers?
Okay. Well, obviously the ultimate or the end game is going to be drowning, right? Everybody drowns. So the question is kind of why do people drown? And it's frequently not related to things like equipment malfunction, blah 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 blah. The statistic that people aren't aware of is that the Divers Alert Network statistics would say that 35% of all deaths in people over the age of 35, okay, not 65, over the age of 35, are cardiovascular disease.
Wow. Wow.
Okay, so that's why there's such a strong effort to look at cardiac risk factors, physical fitness and so forth in diving. I tell my students all the time that we don't get into shape by scuba diving. Okay, if you get into shape by scuba diving, you're probably doing it wrong, right? It shouldn't be that much activity. So we get in shape to scuba dive. We
good.
don't scuba dive to get into shape.
Very good. So the video that I sent you the other day, that gentleman, Brian, he was a 50-year-old, I believe, that was in pretty good physical shape. He was a weightlifter. He was doing seemed to be a lot of the right things, at least from a layman's point of view. And he still had a heart attack underwater. So reviewing that video, what are some of the things that you noticed about it, or some of your takes away from that?
Okay. Yeah. First of all, it's a great video. Basically, you're going to be linking to it. It shows him having some problems underwater. Um, First thing is we don't know what his risk profile was, right? We know he's a 50-year-old man, approximately. We don't know smoking history. We don't know blood pressure history. We don't know diabetes history. We don't know family history. We don't know cholesterol status, right? So all of those things are not requirements to develop heart problems, but they are what we call risk factors, which mean you don't have to have any of those things. The number one cause of death in America for people who are not hypertensive, not diabetic, have no high cholesterol, don't smoke, and have no family history is still coronary disease. Okay. So it's just these things would just make it more likely that this is going to happen to you. So that's the first issue. So I don't know anything about that. It sounds like what he had underwater, and it's semantics to the lay audience, but was an acute coronary syndrome. And what I mean by that is the way coronary artery disease tends to develop is in somewhat of a stair step fashion. In other words, imagine these blood vessels to your heart are kind of little cylinders that are clean as a whistle. Over time, you lay down cholesterol, and these plaques will kind of rupture and then stair step to be more severe. In some people, it goes from a 10% to a 20 to a 30 to a 40 and so forth and so on, and they'll develop stable symptoms of chest pain, angina, when they exert themselves. And those people we can pick up on a treadmill, we can catch them early.
Okay.
Other people will go from 10% blockage to 100% blockage and have sudden death.
Wow.
And how or why I would do one thing and you do something else, we don't really know. We do know that control of risk factors can stabilize those plaques and keep it from that being less likely to happen. So in this case, the gentleman had symptoms of chest discomfort underwater. Okay. And in a 50-year-old man, this is another thing for the listeners. In a 50-year-old man, if you have chest discomfort, chest, neck, jaw discomfort, some sort of exertional symptoms that go on, that occur with activity and go away with rest, okay, that last minutes, not seconds or hours, that has a 90% chance of being coronary
Wow.
disease. Okay. So, and then if women are a little bit lower risk, risk factors, so forth and so on. But in general, 50-year-old man, 90% chance if it's exertional chest pain that it's coronary disease. So if any of the listeners have those types of symptoms, I mean, obviously you guys are be shoveling snow. For me, it's laying out the towels on the beach down here, but
Yeah.
that kind of stuff. So that's the kind of things to be aware of. So he started having exertional chest discomfort. So this sounds like classic angina. Why would this happen to him? Well, probably the exertion of what he was doing triggered a plaque rupture. There's one of these little things we were talking about where you just say you had a little speed bump of cholesterol in this coronary artery that wasn't limiting blood flow at all. All of a sudden, under that stress, ruptured. When that happens, it leaks this milieu of toothpastey cholesterol into the blood vessel, and then blood clot forms on top of that.
Wow.
And then suddenly, this 20% blockage becomes a 90 or 95% blockage and limits blood flow so that when he tries to exert himself, that area is not getting good blood flow and he has chest pain.
Man.
So that's what he had. If that lasts long enough, you will have enzyme elevation. Some blood tests will become positive and show that you've had heart muscle damage. There's kind of two different types of heart attack. The one you hear about, someone crushing substernal pain and they go rushing off to the cath lab to get a balloon or stent emergently. That's when you've got a 100% blockage. You've got this cholesterol blood clot combination, and you've got a complete dam in the river. So there's now no blood flow getting past that. That is often, almost always, not always, evident on an EKG as an emergency. That's why we get those EKGs. Those people be rushed off to the cath lab instantly because time is muscle. The sooner you get that opened up, you convert what would have been a larger heart attack into a smaller heart attack by limiting the damage downstream. In this gentleman's case, he probably had what we would call a non-ST segment elevation MI, which is a complicated term, but what that basically means is he probably had a less than 100% blockage, but had enough injury that there was a blood test elevation. Okay,
Yes.
so those are the people that we still take to the cath lab. We may not take them emergently at 3 o'clock in the morning, but we may take them at 7 the next morning, that kind of thing.
Hmm.
And then basically treatment at that point is determined by how much blockages there are. Your heart has three main blood vessels. Okay, each of those have branches. So the smaller degree of heart muscle jeopardized, the more conservative the treatment. In other words, if you had, think of these blood vessels like branches of a tree. Okay, you have branches, small branches, twigs, right? If you had a blockage in a twig, you could still hurt like heck. Okay, still could cause a blood test to be abnormal, but we'd probably just put you on some medications. Okay. On the other hand, if you had this and we went to the cath lab and you had a blockage at the base of the trunk of all three of those trees, you're heading to bypass surgery.
Yeah.
And then in between would be the ballooning and stenting. So this gentleman sounds like had a four-vessel bypass. He
Hmm.
obviously only had three of these main vessels. So that means he had each of the three main vessels bypassed and one of the branch vessels bypassed. So obviously he had a lot of heart muscle that was jeopardized. So
Wow.
your next question would be, why would that happen to him? Why would he not know about that?
Yeah.
You know, probably, and again, there's no way of knowing this for sure, but probably through years of his life or decades of his life, he was slowly laying down cholesterol blockage in all of his blood vessels, which is commonly what happens. But because it was developing slowly, his body was developing kind of bypasses around that. One blood vessel can make blood vessels around the blockage to another vessel and so forth. It doesn't provide normal blood flow, but can keep that area alive. So probably, let's say three of those four blockages had been doing that over months or years, but it was slow enough and he wasn't exerting himself enough. He wasn't running marathons or something and exerting himself enough to know that there was a problem. And then when this one new vessel all of a sudden had that plaque rupture and went suddenly to a 95% blockage, he starts having pain.
Wow.
They
Okay.
go into the cath lab, they find that blockage, okay, which could be open with a balloon or a stent or whatever, but go, uh-oh, yeah, he has that. Because look what else has been going on over years and years and years. Let's just bypass everything.
Wow. So that's what a bypass is.
Exactly.
Interesting. Very interesting. So, which brings me to my next thing. How can we keep on diving as we age? So, this guy, diving was something that he really enjoyed. Unfortunately, it kind of stopped him from being able to do that for the future, or he lost a lot of interest, he said. But how can we keep diving as we age to make sure that maybe this doesn't happen to us?
Okay. That's a very good question. You can look at things as we age. Okay. We go from, let's say you take children. Children require a lot of supervision, right? They diving. So you don't put two children together. You have to have an adult, someone who doesn't require the extra help. And then as we get older, we transition into being
Yes.
independent divers. As we get older, we transition more back to requiring help. Okay. And the key is you want to delay that transition as long as possible. And then as you start to transition, make sure that transition is as slow as possible. Okay. So the way we do that first is maintain a healthy lifestyle, which I'll talk about in a second. But the first thing is critical self appraisal. In other words, I have a slide set that I show that says, we all think we're who we used to be, but we're not. Okay. I started diving in 1974. And in my presentation, I've got a picture of myself scuba diving in West Palm Beach in 1977, about a month after I competed in the state swimming championships. Okay. Okay. I'm now 63. In my mind, I'm still that guy. Okay. I'm still the 17-year-old, competitive swimmer. I'm not that guy. So critical self-appraisal as to what is an appropriate dive for you now that maybe wasn't on your radar screen in the past. So little things like that. That's the first thing. So critical self-appraisal and being honest with yourself. Okay, maybe you can't dive 300 feet in ice diving in a mine in Finland anymore, but you can probably still go to the Caribbean and enjoy diving in 80-degree water. Secondly is routine health checks with primary care physician and making sure you have things like blood pressure checked, cholesterol checked, get your colonoscopies. If you're a woman, get your mammographies. All those things to try and catch any medical problems that are going to occur, catch them early to keep them from being a problem down the road. Okay.
On that, I just wanted to ask, what are some other health-related issues, and maybe you can work that into your answer, that divers will come across as we age?
Couple just normal things. I mean, obviously our vision drops. You're too young to know that yet, but our vision starts to be a problem. And people have trouble reading gauges and so forth. So little things like contacts, corrective lenses that women are vain about, things like that you need to do. As we get older, orthopedic can be a problem. Carrying heavy tanks, flexibility, getting fins on and off, those sorts of
Mhm.
things. So really, the first thing you want to do is to maintain fitness for diving for anybody. Actually, as you get older, is a three-pronged process. And then we'll talk about some medical issues. The three things that we all need to be doing is cardio. Okay. We talked about that originally, what kind of level of cardio you need to be to. So everyone should maintain some sort of cardiovascular fitness and being able to, I tell patients, I don't care if it's walking, running, jogging, swimming, cross country skiing. I say pick the one either that you like the most or the one you hate the least. Okay. But pick something. Okay.
Yeah.
And do that at least 3 days a week. You try to get, about 120, 150 minutes a week would be ideal of cardio. Then you need to do some resistance training. Okay. We start losing strength beyond the age of about 18 to 20. Okay. So if you're not doing, you may be really buff at 18 or 20, but if you're not working at it, you're not going to be looking like that 10, 20, 30 years down the road. So some form of resistance training that can be as easy as just doing push-ups. Okay. Or it can be a resistance
Okay.
bands. Or if you like going to the gym like that guy was doing, go to the gym, power lift, whatever, but some more resistance training. And then lastly is flexibility. We lose flexibility as we get older. You'll see that in your parents and grandparents. So something, whether anything that's agile, so like racquetball, squash, things like that, or yoga, Pilates, stretching, something like that. So kind of a three-pronged approach: cardiovascular, cardio, resistance training, and then flexibility. So that's what you want to be doing.
Awesome.
As far as your question is, what medical things do we tend to run into as we get older? The high blood pressure. Okay, 50% of people over the age of 50 have high blood pressure. That is very easily treatable. It's known as the silent killer because you don't have any symptoms, but can have all kinds of problems down the road. So keeping very good control of your blood pressure and not being embarrassed to say, "Oh, I don't want to take medications." No, take the darn medications to get your blood pressure under control. We have lots of good medicines now that have almost no side effects. So that'd be the first thing people tend to see. The other thing that we see as we get older is a lot of Americans develop diabetes. It's what's called type 2 diabetes, which is what happens as you get older. It's a resistance to insulin. There's very good medications for that. The main issue with diabetes is not having your blood sugar get too high, which is what diabetes is about, but while diving, having it get too low. Your blood sugar can drop 70 points or more with an hour scuba dive.
Wow.
So getting that under control. There are certain medications that you should not dive with. I won't go into all the details, and certain ones that are fine. So something to talk with your primary care physician about, or whoever's managing your diabetes, about saying, okay, I need to be on these medicines. I want to scuba dive. What medications are going to put me at risk for my blood pressure, or excuse me, my blood sugar dropping? Which ones are not much of an issue? And then steer towards the other ones if you could, and that way you could safely dive. There's a whole chart on Divers Alert Network website about diving with diabetes.
And we'll leave that link in the description below, as well as the video to the previous diver here that I reviewed. So we'll make sure that people have access to that information. I appreciate that. That's good.
And then the last one will be what this guy had, which would be coronary artery disease. So I get probably, like I mentioned, I'm a cardiology consultant at Divers Alert Network. I probably get 3 to 5 emails or some sort of messaging a week about
Wow.
something.
Hmm.
Most of which is, I had a heart attack, can I dive? I had bypass surgery, can I dive? I had stents, can I dive? And the answer to that is probably. Okay. The three things that you need, if you like this gentleman, to return to diving after bypass surgery or stents or just having had a heart attack, are: one, you need to get back to normal exercise tolerance, like we defined before. Okay, so that walking for recreational diving, walking 2 miles in about 30 minutes, have good functional capacity. Number two, you need to have normal heart muscle function. Some people have small, quote unquote, heart attacks, so their heart muscle function isn't really affected.
Yeah.
Other people have
Yeah.
huge heart attacks and are left with very, very weakened heart muscles. When we go into the water, whether it's just swimming or standing in a swimming pool or diving to 300 feet, any of those things, you're going to get a shift of about a pint and a half of blood into the central circulation. If your heart's weak,
Hmm.
that can overload your heart and put you into congestive heart failure where you can't breathe. So people with weakened heart muscles should not dive. But if you've had a quote heart attack that left you with a normal heart muscle function, that's not a problem.
Okay.
And then lastly, on that treadmill, your doctor's gonna do for you to see what your exercise capacity is. You want to make sure that everything that was blocked has been fixed. There's no limitation of blood flow, so that the EKG with exercise looks normal. So I tell people after a heart attack or stents or bypass surgery, once your doctor has cleared you to quote get back to normal activities, okay, you want a treadmill, okay, for test exercise capacity, and to make sure there's no blockages left behind. And then you want echocardiogram, which is an ultrasound test, to make sure your heart muscle function is normal.
Yes.
If these are all the case, you can return to diving without restrictions.
Wow. So along that line, so if somebody has a healthy heart, they're doing everything right as far as their diet, their exercise, and they are aging gracefully. Is there an age limit to becoming a diver?
No, I
Okay,
certified my father at age 79
that's awesome.
because
Wow.
he'd always wanted to dive. My mother wouldn't let him. She hated the fact that I scuba dived, and then that my wife dived, and both our children dived. He wanted to go diving with his grandchildren. Now, that having been said, my father was at 79, 80 years old, was very, very healthy. He and I would go on windsurfing vacations together. Okay, so he's not your typical 79-year-old,
Yeah.
but he could swim. So I put him in the pool. He easily swam 200 yards. He had no problem with that at all. He took a little bit of medicines for his blood pressure. That was it, which was very well controlled. We got him through all the skills. He had no issues with that. He was flexible enough, get fins on and off, and he was strong enough to carry a tank around. That was no problem. So we got him certified. He went scuba diving with our two. I'm an only child, so his two grandchildren. I got some video and some photos. That's one of my favorite photos. Is the picture of him, my wife, and our two children together scuba diving in the Bahamas. And he dove. He died at age 89 and dove till about 85, 86. So
Wow.
it's all a matter of it's those things we talked about. Critical self-appraisal of what are you able to do. So if you're in that situation, healthy, active, there's not an age limit where you have to hang up your fins.
Yeah, my son was getting certified. He's 12 years old, so 2 years ago, and there was an elderly woman who was getting certified along with her grandson, and we were all really just happy for her. She was doing pretty good, and then the open water portion, when she got in the water, she ended up having some health-related issues, and she was apparently cleared by her doctor. That's why I asked that, and we all felt pretty bad for her. She wasn't able to continue, but she probably has something underlying, I'm guessing, maybe that prevented her from being able to move forward with that.
Right. One of the issues is that there is no hyperbaric or dive medicine training in medical school. Okay. There's so many other things to learn. Diving is a very small niche. So it is not uncommon at all for your primary physician to have absolutely no knowledge of diving medicine whatsoever. Okay.
Yeah.
So that's the reason that the Divers Alert Network has a referral network. Okay. The most recent change to the RSTC medical form has a very detailed explanation for physicians because most physicians don't know much about diving medicine. So, if for your listeners, if either they or someone they know is older and wants to dive, I'd recommend taking that, not just the medical form, but that explanation form to their physician because they may look at things. It's usually the other way around. They'll say, "Oh, you're 75, you shouldn't dive." Well, why not? Well, you shouldn't dive. Okay. Or can I dive with this condition? No. Why not? Well, you just shouldn't do it. Because, and I'm not being critical. We are trained as physicians, above all, do no harm, right? So if somebody doesn't understand the risks of something, they're
Yeah.
going to recommend you not do it
Yeah.
because they don't want to put you in harm's way.
Err on the side of caution.
Exactly. Always an error on the side of caution.
Yeah.
So if that were the case, that's the reason to talk to the Divers Alert Network, see if they can get a referral to somebody with some diving medicine knowledge in your area, and they can help your primary care physician along with making those kind of decisions.
That's great. So if somebody is having a question like that or is experiencing this with their doctor, they could just go to Divers Alert Network and get that information and get the help that they need. That's exciting. That's good to know.
Yeah, don't call the emergency hotline. Okay, call the regular hotline, the regular line. Yeah, there's something like 700 physicians across the U.S. that they've got in their network.
Amazing. Well, this has been very interesting. I really appreciate you taking the time out of your busy schedule to talk to me. And yeah, so thank you, sir.
No, it sounds
Appreciate
great.
it very much.
Let's go diving
Okay.
together sometime.
Oh, definitely, man. Yeah, I'm not going to invite you here. Although
No, I'm not going there.
you could dive in the Great Lakes. I'll take you wherever you want to go, but it's a little bit colder than Florida.
Yeah, I did that a couple years ago. That was between ice diving and between Great Lakes diving, I think both of those are one and done for me.
It's all I know. I just know how to dive cold. So yeah, I'm afraid I'm going to dive there and then I won't want to come home. So that's what's going to happen. Well, sir, thank you so much for coming on. You have a great day and we'll talk soon.
You too. Bye now.
Thank you for watching the entire video. I hope I've earned your subscription, a thumbs up, and maybe you'll hit that bell for future notifications. If you'd like to watch another interesting video, well, click right here. You dive safe, and I'll see you in the water.